Clean the earpieces of the stethoscope with alcohol. Expose the patient's arm well above the elbow, extending the arm with the palm up. The arm is supported and close to the level of the heart. Wrap the deflated cuff around the patient's arm above the elbow, snugly and smoothly. Center the bladder above the brachial artery 1 to 2 inches above the elbow. With one hand, close the valve on the bulb, turning it clockwise. Palpate the radial pulse. Inflate the cuff to 30 millimeters of mercury above pulse disappearance. Open the valve slowly until the radial pulse is detected. When the radial pulse is detected, this is the palpatory systolic pressure. Deflate the cuff completely and wait 30 to 60 seconds. Position the earpieces of the stethoscope in your ears. Palpate the brachial artery. Place the stethoscope over the brachial artery. Gently close the valve on the rubber bulb by turning it in a clockwise direction. Inflate the cuff to 30 millimeters of mercury above the palpatory systolic pressure. Release the air in the cuff at a rate of 2 to 3 millimeters of mercury per second, silently noting the systolic and diastolic pressures. Listen for 10 to 20 millimeters of mercury below the last sound heard to confirm disappearance. Then deflate the cuff rapidly and completely. Remove the cuff from the patient's arm and make sure that the patient is comfortable.
Are you comfortable?
Yes, ma'am.
Clean the earpieces of the stethoscope. After leaving the patient's room, write down your blood pressure results in the patient's chart.